What do professional athletes like LeBron James, aspiring teachers, fighter pilots, robotic surgeons, and even students participating in this competition have in common? They use video review to hone their skill. Video review is the practice of recording one's performance and then playing it back for reflection, self assessment, and analysis. Video review isn't new, but in many fields, its use has been limited to training settings such as athletes with coaches, students with instructors, or surgical residents with their attendings. Unfortunately, once training ends, video review and other degrees of support and skill refinement often end with it. My research examines how video review can be used to develop the reflective practice of surgeons in order to improve their robotic surgical skills and reduce the robotic learning curve. Surgeons are faced with continually needing to adapt to new surgical techniques, procedures, and modalities. Surgeons already in practice often find themselves navigating these new learning curves on their own. Independent video review as a means of reflection seems like an obvious solution, but the literature tells us that this is not always effective because reflection is not an innate skill, and without a mentor or guide, they don't know what they don't know. So, with limited support and resources, what can the private practice surgeon working in the rural United States or surgeons working abroad with limited resources do to not just be a proficient surgeon, but expert surgeons? Using Kolb's experiential learning theory and Gibbs' reflective cycle as frameworks, I designed a surgical video review guide that can explicitly teach surgeons effective reflective strategies to enhance independent video review without the need for expert support. Using a two-group experimental design, my study looks at the differences in surgical skills on a robotic simulator between novice robotic surgeons who use the guide during video review compared to those who do not. Measuring the differences in robotic skill improvement between the two groups will determine the efficacy of such a guide. Just like there's varying degree of skill among professional athletes, there is varying skill among practicing surgeons. We know from research that surgical technical skill directly correlates with patient outcomes. While an athlete's skill may be the difference between a team winning or losing a game, surgical skill can be the difference between life and death for a patient. Guided but independent video review offers a tool for surgeons to use in any place, at any time, on their own electronic device. The findings of my research may offer a low-cost, time-effective, and independent solution for surgeons seeking to improve their robotic surgical skills and ultimately to improve the health and wellness of their patients. Thank you.